What you do in the first 60 seconds of getting a stroke attack could kill you. You could be trying to save yourself during a stroke when you're alone, but end up making the attack worse by reaching for certain pills you think will help. In those first 60 seconds, panic takes over, and one wrong move can leave you permanently paralyzed, or worse, dead. Most seniors don't know that taking pills during a stroke can actually make things worse. A stroke can affect swallowing and blood flow, so the pills you think will help may do the opposite. My name is Dr. Hillman, and over the last decade I've treated more than 7,000 seniors diagnosed with different types of strokes. Nearly 62% of the most critical cases involve patients who took certain pills during the attack, thinking it would help, but it didn't. Which is why in this video, I will tell you 2 pills you should never take when you're having a stroke. I would tell you the most common pill first. This pill is in every medicine cabinet in every home. As you watch this, I'm sure it's in yours as well. Then secondly, I would tell you the most deadliest one you must completely avoid. I also know that you never fully recover from a stroke. So I always advise my patients to do the best they can to manage or even stop a stroke attack before help arrives. So I would also tell you 3 things you must do immediately you start to see signs of having a stroke. These 3 tricks that can save you before help arrives. If you are yet to subscribe, subscribe right away. Let us get into it. Pill number 1. Aspirin. Do you know why a stroke happens? Most seniors think that a stroke happens when you get blood clots in your artery, especially the arteries that carry oxygenated blood to the brain. But that is not the only reason. There are majorly 2 types of stroke: the ischemic stroke, that is caused by blood clots, and the hemorrhagic stroke, caused by bleeding in the brain. All 2 types of stroke affect the brain in the sense that the brain needs oxygen and glucose 24/7, round the clock. Even when you are sleeping, it needs it to stay alive. So during a stroke, the brain is deprived of oxygen, and brain cells begin to suffer and die. And this happens fast, within minutes. And it is almost impossible to tell which stroke attack you may be having, as they all present with similar symptoms, like loss of function in the brain area that is affected. If the area controlling the face or arm is affected, you'll see facial droop or sudden weakness, numbness on one side. If speech centers are involved, speech becomes slurred or garbled. If the balance or vision centers are hit, dizziness or sudden vision changes occur. A stroke can weaken or numb the muscles used to swallow. Food or pills can enter the airway, aspiration, and in some cases the normal cough reflex is blunted, so a person may not show obvious coughing even while inhaling liquid or pills into the lungs. This leads to a high risk of pneumonia and makes giving anything by mouth dangerous if swallowing is impaired. So it is important to be very, very careful with swallowing anything, and I mean anything at all, during a stroke attack. But here's the thing. During a stroke attack, most seniors can panic. Even before they call for help, they may try to see if they can do some sort of first aid, pop a pill for pain to get some relief before help comes. And this is where a lot of seniors make the biggest mistake of their lives, by taking aspirin pills. And here's why. Although aspirin is not usually prescribed for blood thinning, what a lot of seniors don't know is that aspirin stops platelets from clumping together. And this means your blood cannot clot easily. And I know that this sounds like very good news, but it is not, because you do not know what type of stroke you may be having. And if you are having a hemorrhagic stroke, it means that a blood vessel has erupted and bleeding and pressure is happening around your brain tissue. Taking an aspirin during this type of stroke turns it into a disaster. Aspirin quickly enters the bloodstream and blocks platelets, the cells that help stop bleeding. This effect happens within minutes and lasts for the lifespan of the platelet. Without platelet activity, bleeding spreads faster, the pool of blood grows larger, pressure inside the skull rises sharply, and more brain cells are crushed or suffocated. What could have been a small bleed can rapidly turn into a massive, life-threatening hemorrhage. Inside the skull, a closed, rigid space, extra blood has nowhere to go. It forms a swelling mass that presses on nearby brain tissue, which can lead to paralysis, loss of speech, vision loss, loss of consciousness, or even fatal brain herniation. As bleeding expands, it can spill into critical regions like the brainstem, ventricles, motor cortex, and speech centers, worsening the stroke within minutes. Even if the stroke is ischemic and caused by a clot, aspirin taken at home doesn't dissolve the blockage. Only hospital treatments can do that. Meanwhile, taking aspirin without knowing the stroke type delays assessment and creates serious risks if surgery or emergency intervention is needed. This is why taking aspirin during a suspected stroke can complicate treatment and lead to worse outcomes in both bleeding and clot-related strokes. Recent research on seniors and aspirin use during stroke shows a sharp difference in recovery. In a large study on older adults, seniors who took aspirin before their stroke were more likely to have bleeding in the brain, about 1.1%, compared to 0.8% in seniors who didn't take any aspirin. So what should you do instead? Remember earlier I mentioned that there are head movements and some tricks to use during a stroke to survive and help yourself during a stroke, and I'll tell you those tricks in a minute. But the next pill you should completely avoid during a stroke, especially because most seniors keep this medication on hand, are blood pressure medications. This one is very deadly and tricky because you may not even know if what you are experiencing are stroke signs or a blood pressure situation. Which is why you must familiarize yourself with what stroke symptoms look like so you can be prepared. When a stroke is happening, the brain is already struggling. Blood flow is either blocked or bleeding, and every second counts. Now imagine a senior taking a blood pressure pill right in the middle of that crisis. Here's what actually happens inside the body. First, most blood pressure medications drop blood pressure fast. And during a stroke, the brain is depending on every bit of pressure it can get to push oxygen through whatever tiny vessels are still open. When that pill kicks in, the pressure falls. The force pushing blood into the starving part of the brain becomes weaker. A brain area that was barely surviving suddenly gets even less blood, and the damage spreads faster. If the stroke is a bleed, the situation becomes even trickier. A blood vessel has already burst. Bleeding is happening inside the skull. Changing blood pressure suddenly, up or down, can make the bleeding expand or shift into nearby brain tissue. The skull cannot expand, so the extra blood has nowhere to go. It presses on the brain, squeezing areas that control movement, speech, or consciousness. And there's another problem: swallowing. During a stroke, swallowing becomes weak and uncoordinated. Taking a blood pressure pill can lead to choking or the pill slipping into the airway. That alone can cause a dangerous complication and delay treatment once help arrives. So instead of helping, that one pill can lower blood pressure at the wrong time, speed up brain damage, make a bleed expand, and complicate emergency treatment. It creates the perfect storm, all before the ambulance even gets there. Recent research shows something most seniors don't expect. In a large study of over 12,000 stroke patients, doctors found that lowering blood pressure too early, especially in the first few hours or days of a stroke, didn't actually help recovery. In fact, it didn't change the outcome at all. And in seniors over 80, another review found that taking or continuing blood pressure medicine came with a much higher chance of dropping the blood pressure too low. Now that you know some of the pills to avoid during a stroke, that is only half of the puzzle. Let us talk about what you can actually do during a stroke to survive before you get help from professionals. And this is all about your head movements. A stroke happens in your brain, so how your head is positioned during a stroke is extremely important, because the wrong position can either restrict or improve blood flow to the affected areas. And these head placements should be used most times with what the symptom of the stroke presents. Number 1. Slightly elevate the head, about 30 degrees. When a senior is having a stroke and the head is lying flat, blood flow and pressure inside the skull begin to work against each other. The brain is already starved of oxygen. Lying flat increases the pressure in the tiny vessels around the damaged area, making it harder for blood to move into the parts of the brain that are barely holding on. For some seniors, this flat position can make the swelling worse and speed up the spread of the stroke. But when the head is lifted slightly, about 30 degrees, something different happens. That small angle helps reduce pressure inside the skull while still allowing enough blood flow to reach the brain. It's a balance point, not too high, not too low. just enough to ease the strain on the brain, calm the pressure, and keep blood moving. Recent research backs this up. Several hospital studies comparing flat versus elevated head positioning found that a gentle elevation helps reduce intracranial pressure without significantly lowering blood flow. This is why many emergency teams and stroke units position the head this way as soon as they suspect a stroke. It protects the brain while waiting for treatment. I remember one of my patients, a 72-year-old man, who used this simple trick. He was alone when the symptoms started, the dizziness, the numbness, the slurred speech. He told me later he remembered my instructions, grabbed the closest pillow he could find, and propped his head up before calling for help. That small action kept him steady, kept him breathing clearly, and kept the stroke from worsening before the ambulance arrived. It didn't cure the stroke, nothing can, but it helped him hold on long enough for treatment to work. If you ever feel stroke symptoms and you're alone, here's what to do. First, sit down or lie back slowly and slide a firm pillow or a folded towel behind your upper back so your head is lifted just a little, about the height of your hand. Next, make sure your head is straight and facing forward. Don't let it fall to the side or tilt backward. Finally, keep your neck supported and your chin slightly down so your airway stays open and your head stays steady while you call for help. When I say don't let your head fall to the side, I'm talking about the normal situation, the moments when you're not choking, not vomiting, and you can still breathe normally. In those cases, keeping your head straight helps the blood flow stay steady and reduces pressure in the brain. But if you start vomiting, choking, or you suddenly can't swallow well, that is different. In that moment, you must consider the second head position. Number 2. If the person is vomiting, choking, or cannot speak clearly, turn the head gently to the side. If you're vomiting, choking, or suddenly unable to speak clearly during a stroke, and you do not turn your head to the side, here's what happens inside your body. The vomit can slide back toward your throat instead of out of your mouth. Because your swallowing reflex is weakened during a stroke, your body can't protect the airway fast enough. The liquid can slip into the windpipe, blocking airflow and causing you to choke. In severe cases, it can even enter the lungs, leading to aspiration, which can cause pneumonia or sudden breathing collapse. Your brain is already struggling for oxygen during a stroke, and choking cuts it off even more, making the damage happen faster. But when you turn your head gently to the side, and turn the body with it, everything changes. The throat stays open, gravity helps the vomit or saliva fall out instead of back, and the airway clears. This simple shift makes it much easier to breathe, prevents aspiration, and keeps oxygen flowing to the brain until help arrives. This is why this position is part of the classic recovery position used by emergency responders worldwide. A small emergency care study found that stroke patients placed in a side-lying recovery position had significantly fewer airway blockages compared to those left on their backs, especially when vomiting or drooling was present, confirming how crucial this simple head and body turn can be for survival. Remember, you turn the head and the body together, gently, so the neck isn't strained. Now let's connect this to something just as important, your lifestyle choices. A lot of seniors don't realize how quietly certain habits increase stroke risk. Smoking slowly scars and hardens your arteries. Sitting for long hours makes your blood flow sluggish, giving clots a better chance to form. Eating salty, sugary processed foods pushes your blood pressure higher and inflames your vessels. And constant stress keeps your pressure elevated for hours without you even noticing. But here's the encouraging truth. I have patients, some as old as 93 years old, who have never had a single stroke episode, not even once. And it's not luck. It's because they follow a clean, protein-rich diet that keeps their vessels flexible, their muscles strong, and their blood pressure steady. So let me give you 4 simple, high-protein balanced recipes you can start using today. 1. Grilled salmon and quinoa bowl. Season a salmon fillet with salt, pepper, garlic, and a little olive oil. Then grill or pan-sear it for 3 to 4 minutes per side. Cook half cup of quinoa in low-sodium broth until fluffy. In a bowl, add a handful of spinach, sliced avocado, the warm quinoa, and place the salmon on top. Finish with a squeeze of lemon. The combo gives you clean protein, healthy fats, and steady energy. 2. Chicken and lentil stew. In a pot, sauté onions, garlic, and diced chicken breast until lightly browned. Add half cup of lentils, chopped tomatoes, turmeric, and low-sodium chicken broth. Simmer for 25 to 30 minutes until the lentils soften and the stew thickens. This meal gives fiber, protein, and anti-inflammatory benefits, perfect for blood pressure control. 3. Greek yogurt power parfait. In a glass or bowl, layer 1 cup of Greek yogurt with a tablespoon of chia seeds, a handful of nuts, like almonds or walnuts, and a handful of berries. Repeat 1 more layer. The yogurt provides protein, the nuts add healthy fats, and the berries supply antioxidants that protect blood vessels. 4. Egg white veggie scramble. Whisk 4 to 5 egg whites with a pinch of salt and pepper. In a pan, sauté mushrooms, bell peppers, and onions in a teaspoon of olive oil. Add the egg whites and cook gently until fluffy. Serve with a scoop of cottage cheese on the side for an extra protein boost. This keeps blood sugar stable and supports strong muscles. And if you want even more options, I've put together a high-protein cookbook with 93+ recipes designed specifically to help seniors protect their brain, heart, and muscles with food. You can find the link in the pinned comment or the description below. Before you go, I want to ask you something important. After everything we've talked about, the pills to avoid, how strokes actually happen, the head position tricks, and the lifestyle habits that reduce your risk, have you or someone you know been experiencing any warning signs of a stroke, like sudden weakness, facial drooping, slurred speech, dizziness, or difficulty swallowing? Your answer matters. Share your experience in the comments. I read and respond to every single one. And in my next video, I'm breaking down the early silent stroke warnings most seniors miss, the signs that show up days or even weeks before an attack. These can save your life, so make sure you subscribe right now so you don't miss it. See you soon, Senior Food Blog.